the importance of your health and hearing history. That's the topic for today on Ask the Hearing Doctors. Hi, I'm Jim Cuddy, and this is Ask the Hearing Doctors, and I'm joined by Dr. Anna Anzola, Dr. Wendy Thorne, doctors of audiology at Hearing Doctors, the Washington, D.C. area's highest-rated audiology practice with over 1,500 five-star reviews. Anna, Wendy, let's get right to it. Now, I imagine, well, let's say for this episode of our little get-together, I'm coming to you as a patient. But it's probably very overwhelming for somebody like me. I'm nervous about it. I don't want to admit I have hearing loss and that kind of thing. Is it because I'm afraid to know for sure? Is this common? And how do you handle that when you're meeting somebody for the first time?
Yeah, I mean, I think for us, we get that a lot. But what we do get is, I can't believe I did not do this soon enough. Or sooner. It's one of those realizations that once you actually take the step, we congratulate you. Everybody should get their hearing tested. It's not scary. It doesn't hurt. It's just a very simple test where we put you in a booth. You listen to some tones, and it comes back with a graph that gives us a clear idea of what your hearing sensitivity is like. And then we take it from there. But we go over a very thorough history, talking about other potential problems that you could be suffering and you may not even know. Even that there may be some correlation between what, like we have diabetes and things like that. And we kind of connect the dots for our patients.
Let's say, I don't know if you get this, but there are a lot of people that fear the dentist. I mean, just absolutely fear the dentist. Please, I can't get in that chair. Okay, so maybe that's all of us here. So if you have somebody like that who just, for whatever reason, they have a fear of going to see an audiologist, what would you suggest for somebody like that in order for them to feel more comfortable coming in?
So I always try to take the approach, that when they're coming to see me, no one's really excited to, like you said, it's, especially if you've never done this before, you have no idea what it's going to be like, are you going to walk out of there with terrible news? I always try to tell, the people that come to see me that this is very personal to me. I love this. This is my passion. I fit my father with hearing aids, my sister with hearing aids. So I'm going to treat everyone I see just like I would anyone in my family. So I know it's a very nerve-wracking thing, but we are very caring, and we're going to definitely take care of everyone and make it as comfortable of a transition as possible.
Yeah, I mean, we even have a therapy dog here, so.
Oh, do you really?
Yeah, we do. Her name is Prada.
Now I really want to get my ears checked. I love dogs. Let's walk through, if you would, what I can expect from that first visit to a hearing healthcare professional.
You mean so when they come in?
Yeah. Okay. So I've just come in for the very first time. Oh, I'm nervous, whatever that is. But what do I expect? What am I going to get from you as far as what you're looking for from me?
What we ask is that you come in with your loved ones, somebody that is really close to you, or maybe if they were the ones complaining about your hearing status.
This is my backwards way of getting them to come in to see the audiologist.
I think that will make a big difference, because then we can put things together for them as well. So we're going to explain to you exactly what the findings were, right? And then we're going to explain it to your loved ones. And I think that connecting the dots for them will give them the empathy. If you are truly suffering from some sort of hearing deficiency, they will now start to understand, rather than, you're not listening to me, you're not hearing. And that was the end of that. But if I show them, this is what he or she is suffering from, and this is how they hear, it really changes the whole conversation.
Oh, so that would make things better at home.
Yes.
You know, when you have that kind of fighting because you don't understand that the person has a hearing problem, or that makes a lot of sense. Health history. Why is it important, if I come to you, why is it important for you to know my health history? Why does that matter?
There are so many different diseases and illnesses that can either suggest hearing loss, or that they can coexist together. I know we've talked about cardiovascular diseases.
Diabetes.
Diabetes is another really big one. There's also other things like kidney disease that can, suggest hearing loss. Any strokes, heart attacks sometimes, which would go along with cardiovascular.
Right.
Trying to think if you can think of any others. There's
Like a TIA, trans ischemic attack as well.
So if by my telling you my health history, diabetes or cardiovascular disease, that's a red flag for you. That says, sure. You probably do have a hearing problem then.
Exactly.
And so at that point, does that help you in diagnosing, or does it just tell you, okay, this is potentially an issue that causes hearing?
I think it opens up the communication in the relationship and how we interact. So I'm going to tell you about hearing, but we're also going to maybe explore other situations for you that you maybe need to keep an eye on, right? Mm-hmm. So it really changes the way we communicate with our patients. Mm-hmm.
Some of the other general health conditions associated with that are important when evaluating hearing. What other ones are there? We've talked about diabetes. We've talked about cardiovascular. Are there other ones that jump out that say, ooh, that could be part of the reason why you have a hearing loss?
Yeah, we talked about vertigo, dizziness. That's always something very important to get it always checked out. So we take more of a holistic approach to hearing, not just the 2 ears that you have.
Right.
Yeah, and we also talk about, have you ever been exposed around loud noises, and if someone's like, I'm a construction worker, or, I love to go to live concerts every weekend. Those are different things that we can also kind of keep in mind and it may not be something they need hearing aids for, but they definitely need hearing protection for.
So you would want to know not only my health history, but perhaps even what I do for a living, or what do you do for entertainment, and that kind of thing? I mean, would it get in that deep to find out?
Sure. Mm-hmm. And we're going to really get to know you, but also get to know your family history, get to know if you've had middle ear issues or ear infections. That sort of thing really gives us a lot of information and how we can, take a better approach to get to the bottom of it.
So if I had an ear infection as a kid, right? I'm 60 years old now, but as a little kid I had a couple of ear infections. Do you need to know that?
Yeah, it may not
does that help you
it may
to know
not be
that?
significant enough.
Right.
We're looking at a history, like 6 ear infections a year, that sort of thing.
All right, so I've come to you, we've gone over my family history, my medical history, and now you know everything that may be adding to or contributing in some way to my hearing loss. But if I have cardiovascular or disease or diabetes or whatever it is, are you in touch with my primary care because of that?
I don't know if it's because of it. I think that's our practices. With our patients' permission, we communicate with their primary physicians all the time. And so not just the first time that you came to see us, but just overall, every 6 months, we send them a full report, and then just giving them an idea of what's actually happening with them, or what type of approach we're taking with the hearing to really address that.
Does it help to, when you talk to my primary care, to find out specifically the medicines I'm on, because I may have forgotten one to tell you about? I know we've talked in the past that some medicines can actually contribute to hearing loss.
Yeah.
So, we have a really good relationship with a lot of the physicians in the area. So, sometimes if we need more information, they're willing to provide that for us if we have any questions. But, like Dr. Anzola said, we always are communicating with them, and we make sure that we have a good open communication between us, you as the patient, and the physician. It's going to be a whole team approach.
And their family members. I think it's just so important.
Yeah. Well, it's nice, it's comforting to know that if I were to come in here, you get to know me as a person. Exactly. You get to know my family if I'm bringing a family member with me. That right there would make me feel a heck of a lot more comfortable about whatever the diagnosis might be.
Right. Whether you take action to correct the issue if there's there, but at least now you have a baseline, and then we can take it from there.
Great. Anna, Wendy, thank you so much. As always, we appreciate it, and we look forward to doing it again soon. If you're in the Washington metropolitan area and you'd like to schedule an appointment with hearing doctors, click the link in the description or visit hearingdoctors.com.